So let's start tonight's program with an email question that I recently received. It reads, Dear Dr. Fawver, what are you most looking forward to for the future of depression or anxiety treatment? Are there any newer medications that stand out for you? I think over the next few years, we're going to be hearing about a lot of medications that affect this neurotransmitter called glutamate. Glutamate is the accelerator on the gray matter of the brain, the outside part of the brain, the thinking part of the brain. And right now we have a medication that's FDA approved. It's a nasal spray called Spravato nasal spray. It's been out for about 8 years now. Spravato nasal spray is a means by which people can get very rapid relief from depressions, twice a week treatment for the first month, once a week the second month, and every other week or once a week thereafter. So Spravato was the first of the bunch that got FDA approved for the treatment of depression. And then we have Auvelity. We've had Auvelity available for about 5 years now. Auvelity is a medication that is an oral medication that will also affect glutamate. So again, if you affect glutamate, you're going to get fast relief and rapid onset of action with an antidepressant medication. And we're getting away from the medications that exclusively affect serotonin, norepinephrine, and dopamine. If you think about glutamate as being the accelerator on the brain, GABA is the brake on the brain. So glutamate and GABA in the gray matter of the brain are kind of like a teeter-totter, and they got to be in balance. On the other hand, serotonin, norepinephrine, dopamine, they're coming from the brainstem part of the brain down here. So they're kind of giving advice to glutamate and GABA, whether they should enhance their actions or dampen them down. So norepinephrine, serotonin, and dopamine have their roles as well. People frequently ask me, well, what's the role of psychotherapy, talk therapy? We're always talking about these medications. Well, keep in mind, psychotherapy or talk therapy acts as a GPS for your daily activities. When you go to an unfamiliar city, you're often going to use your GPS, and that little person on that GPS machine is going to be telling you, turn right, turn left, keep going another mile or so. It's giving you direction in an unfamiliar area. That's what psychotherapy does. If you have little experience in a particular stress in your life in which you're enduring, if you don't have coping skills to deal with that stress, psychotherapy is there for the purpose of giving you direction to reach your eventual treatment goal. So as we talk about medications for depression and anxiety, I think there's going to be a lot of emphasis on glutamate. You're going to hear a lot about the psychostimulant medications like psilocybin. Psilocybin at tiny microdosing can be helpful for people with severe depression and post-traumatic stress disorder with maybe one dosage. I just saw a recent study showing that one dosage of psilocybin in a controlled environment did give people dramatic relief with suicidal thinking. Now, what psilocybin is doing, it's affecting a chemical in the brain, a particular receptor called serotonin 2A receptors. And if you affect that specific receptor, serotonin 2A receptors, it's one of 14 different receptors for serotonin. But if you affect that simple receptor, you can kind of get the brain out of the funk where if you have depression, it's severe depression with suicidal thought, it's thought that you have a kind of an idling going on in the brain where you can't get out of the idling. What you need to do is get it in gear and get going. But when you have severe depression, you can't get it out of that idling, and you idle with ruminative thoughts, past regrets, you think about suicide. So what do? You address it by stimulating the serotonin 2A receptor very abruptly but very briefly. And in doing so, that's how the psychostimulant medications can be effective for depression and post-traumatic stress disorder. We're hearing the same type of efficacy with some people with medications like LSD, which has been around for 70 years now, at tiny microdosing. My hope in the future for the treatment of depression and anxiety, however, will be that we'll have measurable means of determining if our treatments are working in the everyday population. Okay, in clinical trials, we're getting symptomatic relief, which is great, but I want to see us actually have measurable means of determining if somebody's getting their lives back. Now, we have some functionality scales where we're determining if people are getting back to work, they're socializing, they're enjoying things. That's great. We need to do that, but I think we need to step it up a notch and figure out how much people are able to get their lives back once they get out of severe depression. So I'm hoping that will be the case as well. Thanks for your email.